Good morning. Today we're going to discuss about hyperhidrosis or excessive sweating. First of all, what are the causes of excessive sweating? Some are unknown. Some patients simply sweat way too much. This is not something that only happens when it's very hot, but really it happens even in winter and leads them to live a very isolated and withdrawn life, and also interferes with their everyday activities. Then there is a secondary hyperhidrosis, which is usually caused by medical condition. Pregnant women can sweat, or patients with lymphoma or hyperactive thyroid, among many other conditions. So for patients that have primary hyperhidrosis, that is unknown cause excessive sweating, what can we do? About it? Well, there are first some antiperspirant. These are very strong deodorants, and they contain aluminum chloride, which blocks the sweaty glands. Some patients don't like this very much because they tend to get a little bit of irritation and they are not that effective. A second option, especially for hand and feet sweating, is called iontophoresis. This is a machine where a weak current passes through a bowl of water, and the ions that are contained in the water basically block the sweaty glands. This normally needs to be done at the beginning 2-3 times per week, and each session lasts about half an hour. Once you reach the desired effect, then it can be done around once a week. The problem is that many patients find this quite inconvenient and they tend to abandon the treatment after a while. Another treatment is to take a tablet. These drugs basically block the neurotransmitter that cause the excessive sweating, the acetylcholine. The problem is that the effect of the drug is not selective on the hands or the feet, but blocks the neurological transmission everywhere in the bodies. So side effects can be constipation, difficulty to urinate, dry mouths, stomach cramps. And so some patients, after a few months, in my experience, discontinue the treatment as interfere far too much with their normal lifestyle. Another treatment involves to have an operation, which is called endoscopic thoracic sympathectomy. So that means it is an operation that is done through a small camera, through small incision, each one of few millimeters in diameter. We introduce a camera in the chest and we interrupt a sympathetic chain that is a long nerve that runs along the spine. The problem with hyperhidrosis patients is that this nerve is anatomically normal but functionally hyperactive. So dividing the nerves, we can reduce the sweating in the palms and the feet. Side effects from this operation are compensatory sweating. Sweating is a natural mechanism to keep the body temperature constant. If we stop the body from sweating in the hands and the feet or the axilla, then the sweating can occur somewhere else. Most of the time is in the back, but the vast majority of patients feel that this is a much better situation compared to sweating in the hands. There are some other side effects, such as Horner syndrome, that is when you go too high and you divide the nerves far too high, and that can have problem with the eyelid. But if you're interested in knowing more about the treatment for hyperhidrosis, please do contact me, and I will be very happy to go through your situation in details.